Hello everyone. In this particular video, we are going to discuss about asthma. Remember, it is only a short overview about the asthma. Firstly, coming to the definition of asthma, asthma is a chronic respiratory condition. It was characterized by inflammation and a narrowing of the airways. What happens in this particular disease is that the airways get inflamed and they become narrow, and it leads to the breathing difficulties. When the airways are inflamed and they become narrow, the air passage is very difficult and hence the breathing problems occur. It is a common condition. It can range from mild to severe, but sometimes it often requires lifelong management. The causes of asthma are genetic predisposition, environmental factors, immune system responses. But coming to the triggers of asthma, there are many allergens which trigger the asthma in the body, like pollen, dust mites, and pet dander. Respiratory infections, smoke, pollution, cold air, physical activity, and stress, all these can trigger asthma in the body. Some symptoms of asthma are wheezing sound is produced while breathing, and shortness of breath is observed. Chest tightness or chest pain is observed, and normal coughing or extensive coughing is seen during early morning and at night times. Types of asthma. Generally, asthma is of three types, that is allergic asthma, non-allergic asthma, and exercise-induced asthma. Allergic asthma, the asthma is triggered by allergens, and in non-allergic asthma, the asthma is triggered by irritants like smoke or strong odors which irritates the natural mechanisms of the body. And exercise-induced asthma it occurs when some physical activity is done by the person. The diagnosis of asthma is generally done by pulmonary function tests, generally called PFTs, where the spirometry is used to measure the lung capacity. And allergy testing and evaluation of medical history helps diagnosis better. Coming to the treatment and management of asthma, medications were used like for long-term control. Medications like inhaled corticosteroids, leukotriene modifiers were used. For the quick relief from asthma, bronchodilators like albuterol was used. And lifestyle adjustments should be really helpful for the asthma patients. It is to avoid triggers and allergens which lead to asthma, and should maintain a healthy lifestyle with regular exercise, but the exercises should be under guidance of the doctor or some expert. Severe asthma attacks, it really need emergency care, and sometimes the long term airway remodeling should be considered if it was poorly managed. And the thing is that asthma cannot be cured, and the only cure is that it should be is prevention. The only cure is the prevention. It should be effectively controlled through regular medical care, and the patient should be adherence to the prescribed treatment. That we should inquire if the patient is shows adherence to the prescribed treatment, and we should avoid the triggers. We should literally avoid the triggers. Regular monitoring and having An action plan in place of can help manage symptoms and prevent attacks.